Today we're going to talk about how to use a closed system lab collection device, such as a bifuse, trifuse, or quadfuse. First, you want to gather your supplies. This includes hospital-approved disinfectant scrubs, a trifuse, bifuse, or quadfuse, a septic cap or passive disinfectant device, at least one empty 10 ml syringe, at least one 10 ml pre-filled saline syringe, appropriate lab tubes and their labels, hospital-approved blood transfer device, non-sterile gloves, and a mask. You will want to prepare your trifuse on a surface area that's cleaned by the hospital-approved disinfectant wipes, so we'll go ahead and do that now. This is likely going to be a Maya stand. We will allow that to dry for the appropriate amount of time, and we will clean our hands and put on gloves. Today we're going to practice using a trifuse. Your supplies will include a trifuse, at least one 10 cc syringe, and at least two 10 ml pre-filled saline syringes. So we will set up our supplies on our clean surface, and we will open it up. This is what your trifuse will look like with its 3 lumens. You will put your one pre-filled 10 ml saline onto an end, an empty 10 cc syringe in the middle, and your other pre-filled 10 ml saline on the 3rd lumen. This is what it will look like. Before you apply this to the patient to draw labs, you will need to prime these 3 lumens and clamp after doing so. So I will prime the 1st lumen, make sure I get the air out, and clamp. I will not prime this because there is nothing in it, so I will go ahead and clamp it. And the 3rd lumen with my other saline, I will prime as well and clamp. When you go to draw labs, if they have something running like fluids or TPN or blood products, you will of course stop and clamp the tubing for that, especially if this is a double lumen CVL. You will need to clamp the other lumen prior to drawing labs. So what you will do if they are coming in for labs and don't have anything running, you'll remove the Curos cap and you will attach. And you will unclamp the patient. You will first unclamp your saline. You will flush and draw back for blood return. You will also draw your waste into this 1st syringe. You will clamp it prior to moving to your empty syringe to draw your labs. You will unclamp and draw back the blood that you need for your labs, and then clamp. And then your 3rd syringe, you will flush and clamp. You will also then clamp your patient's line. And at this point, you can disconnect. Your labs will be in the formerly empty syringe, and you are then able to apply a Curos cap if they are waiting to see if they need fluids or blood products, or if they are waiting to have something else hung. They will need to be heparinized before they go home at this point. If they are getting connected back to whatever was running prior to you disconnecting them, you will of course scrub the hub and reconnect them as appropriate.